Hi, this is EliseWalker doing my trach and suction videos. I'm going to start with the suction first. So I verify any orders that I have, I gather my supplies, head into the room. Hi, my name is Elise, I'll be your nurse doing some trach suctioning. I wash my hands. I identify the patient using their name and date of birth, and it matches the MAR in the computer. I introduce myself, I explain the procedure. I'm just going to suction out your trach. I position the patient and do a respiratory assessment, listening for their lung sounds. Next, I'm going to place a towel over the patient. And then I'm going to open my kit. And I think that was my box, yes. So I get my box to put the saline in. Oh, and I be careful not to touch the inside of the box. Then I open my saline. I don't know. Okay, we'll just put this on the bottom of the box in case it leaks. Then I'm going to open my saline. Okay. Next, I'm going to open the kit. I'm going to put on my sterile gloves. Okay, so I'm sterile. I've got my sterile seal. And then I'm going to open this package. I'm going to wrap this, so my right hand is my dominant hand. So I'm going to connect the catheter to the suction, and I'm going to suction some normal saline first to make sure that it's suctioning properly, which it is. And then I'm going to insert the suction, and I go until I meet resistance, and then I can start suctioning let the patient cough, and then I slowly remove it. And then I take my non-dominant hand, I put the oxygen back on if needed, and I rinse my saline again. I assess whether the patient needs another round of suctioning. If he does, then I do another suction. I perform oro and nasal suctioning. When I'm done, I disconnect the catheter and I wrap it in my hand, and I take my glove, wrap it, and then I can discard it. Discard all my supplies into the trash. Put that in the trash. Next, I do a respiratory assessment again. I observe the airway secretions. I document my data in the computer, wash my hands, make sure the patient has their call light, and I put the bed back down to the lowest position. And I'm done with the suctioning. Next, I'm going to do my trach care. So once again, I verify my orders, I gather my supplies, which I have right here. I'm going to use my saline again. Okay. And I'll just pretend like this is the patient over here. So I gather my supplies, I come in, I do my hand hygiene. Hi, I'm Elise, I'll be your nurse tonight. I'm going to be taking care of your trach. Can I get your name and date of birth? I check their name and date of birth and match it. I position the patient, do my respiratory assessment. Oh, I was supposed to check their oxygen as well. I check their oxygen. Then I open my kit. So I take out my sterile gloves and I'm going to put them over here. Next I take out my drape. And put it down on the table. And then without touching the inside of the kit, I'm going to dump my supplies onto my sterile field. And I'm going to fill the big basin with half hydrogen peroxide, half saline. And then the other two I'm going to fill with saline. Next, I'm going to put on gloves and I'm going to remove the old cannula by twisting and pulling out. I'm going to drop it in the hydrogen and the saline solution. Then I'm going to put on my sterile gloves. So now that I am sterile, I can take my brush and I'm going to pick up the cannula and I'm going to use the saline and peroxide to clean the inside and the outside. I'm going to make sure that I clean all the secretions off. Once that looks clean, I'm going to put it in one of the normal saline to rinse off the hydrogen peroxide. Then I can discard my brush. Once I rinse the cannula with the saline, I'm going to replace the cannula and make sure that it's secure. Okay. Next, I'm going to clean the outer area with Q-tips. Oh shoot, before I replace the cannula, I'm supposed to dry it with the gauze and the pipe cleaners. So I dry it, use the pipe cleaners, and I dry it. Once it's all dry, then I can replace it. So after I replace it, then I take my Q-tips and now I'm going to clean the plate in behind. So I dip it in the saline and I clean behind, going from inner to the outer. And I just keep cleaning the plate. Discard that. Once I'm done cleaning the plate, I can place I can remove the dressing. First I'm gonna put a new tie on, and I want to make sure that there is a finger breadth between the trach and the neck, and I want to assess for skin breakdown. So once I put on the tie, put it around their neck and tie it, I can take off the old trach dressing and put a new one on. So I'm going to put the new trach dressing on, and everything is done. So I'm going to dispose of all my supplies. And I'm going to assess their respiratory status again, make sure their oxygen is still good. I'm all done, so I'm going to take off my gloves and I'm going to wash my hands, and I will compare the respiratory status with the old one, document, and make sure the patient is safe, has their bed down, call light in place. I'm all done.